I'm Michael Battelle, president and founder of the Fatty Liver Alliance. We raise awareness about the risk, causes, and complications of fatty liver disease and help those already diagnosed with MASLD and MASH by advocating for access to approved treatments and care. Today, as part of our patient-focused series, Liver Insights, Illuminating the Path Through MASLD and MASH, I'm excited to introduce Dr. Nadege Gunn, who's a gastroenterologist and hepatologist in Waco, Texas. She's the senior scientific advisor and medical director at Velocity Clinical Research. Today, in part five of our special series for patients who have already been diagnosed with MASLD or MASH, we'll be discussing navigating daily life with liver disease, practical advice on living with and managing liver disease in everyday life. Dr. Gunn, over 30% of the population has MASLD and about 20% are estimated to also have MASH. Many already know that they have these liver diseases. Was wondering if you can share your advice with regard to what patients should do who are living with these diseases and trying to manage them.
Really, thank you, Michael, for the invitation to be to share with you today. Um, Liver diseases, especially MASLD and MASH, are pretty quiet diseases overall. You know, people don't necessarily always know they have them, and if they do, many are forgotten in the sense that they don't know what there is to do about it or how they should journey life with this disease. And so, my advice is always to stay 100% informed. Raise the alarm, be your best advocate. Let people know this is going on with me. And I want to always be on the cutting edge of all things that are going on with this disease. That would probably be the first bit of advice.
Okay, and not to feel stigmatized because of what you have. I think that's an important message too, right?
Absolutely. I have prepared some information
Oh,
to
sure.
share so that you can share with your group and all those who are dealing with this disease. If you don't mind, I'd be love to share.
Can't wait.
Okay. Okay. Are you able to see the slides?
Yes, thank you.
Okay. Okay. So, what's most important really here when you have a patient or an individual, if one of you maybe is dealing with MASLD or MASH, the most important things are really how you feel, how you function and survive. As you know, liver disease, no matter what the cause, whether it's metabolic or due to a virus or autoimmune or genetic condition, the end stage or the last stage of all liver disease is potentially cirrhosis. And that's when people really develop true illness and sickness. And that's what we want to ultimately prevent. So, on a path to preventing cirrhosis, we want to ensure that everyone has a good quality of life, that they function well, and that they're able to survive long lives. So this was actually something that came up on a blog or a little chat that my nurse practitioner shared with me a few months back, and she said that one of the moms on this group had a serious question and she wanted to share it with her peer group. She said, "Okay, mom, serious question. I need to know, does anyone else have fatty liver and enlarged spleen? I'm freaking myself out. And yes, I've already started dieting, eating healthy, but let's be honest, I'm scared. Please tell me I'm overreacting." And the question is this type of sentiment typical? And if this is you, how do you go about life feeling this way? And Dr. Yunasi, one of our esteemed colleagues in the field of MASLD and MASH, has done a lot of research on health-related quality of life and how people feel and the outcomes of people who truly are dealing with early stages of fatty liver disease, MASLD. Um, and basically, having this disease sometimes has a negative impact on your physical and mental health. Sometimes it can be detrimental to the quality of the relationships and the activities that you perform every day. And sometimes it can truly have a high symptom burden. Many people with liver disease due to steatosis are complaining of fatigue, anxiety and depression, poor sleep quality, sometimes abdominal pain, or even difficulties with thinking clearly. So, what I would recommend, number one, is definitely a good support system. And that's where you come in, Michael, and your group. Really getting patients together who share the same disease to talk openly, keep your close friends and family in the loop. Let them know about your conditions, what treatments you're potentially entertaining, and how you're feeling, because a good support team is invaluable. And maybe the first person to recognize something is wrong is not you, but it's a friend that knows you. Joining a support group and connecting with other people that are going through similar experiences is truly vital, because other people know things you don't know. And so that is, it's just paramount to connect with others, lean on others, learn, and this could make a big difference when dealing with chronic liver disease. The second thing is proper nutrition. We know the pillar of metabolic dysfunction associated steatotic liver disease is potentially diet and being overweight, being affected by obesity. So, tracking your food intake, maybe keeping a journal every day to know what your body truly needs and what it doesn't need, and making sure that that diet is balanced. Monitoring your weight is really important, because you just don't want to forget that there is a certain body mass that you potentially should be within, your body fat percentage, your waist circumference. If there's any fluctuations in your weight, you want to be aware of those so you can address those early rather than letting your weight sneak up on you. Something that's not talked about often, especially when you're dealing with metabolic dysfunction, liver associated liver disease, is alcohol and avoiding alcohol at all costs. I know there may be some controversy about how much alcohol is okay. Is it a little bit, maybe a drink or half a drink a day? But truly, alcohol is not good for the liver. It's a bit toxic in essence, and so it should be avoided if possible. And also those non-prescription supplements. I think that sometimes you might hear a TV commercial or maybe something online that says this is a liver cleanse, or this might be something that would be protecting your liver from further deterioration, but that's really untrue, and you want to avoid anything that's not prescribed by your providers for your liver. Physical activity is super important. There has been some recent data to suggest 8,000 steps a day is a good marker for people with liver disease due to metabolic reasons. And so people should target trying to get that physical activity in. And even if you're not accustomed to walking a full track or your neighborhood, maybe just parking a little bit further at the local grocery store or the mall can get those extra steps in. I also think it's important to have a strong healthcare team, a primary care doctor that you trust, that you can talk to every time you have an encounter, to talk about changes and things that you should look for. Maybe engaging the help of a dietitian or a nutritionist to help you navigate your weight and your food intake. And then also, if needed, especially as the liver disease advances, you may need a liver specialist to really weigh in on the screenings and preventative things that are important. And the last thing I would say to helping anyone with MASLD and MASH journey through life and navigate through their disease is keeping up to date about emerging treatments. There are many treatments that are coming to fruition now. We just had our first drug ever FDA approved here in the United States for the treatment of MASLD and MASH, but there are many coming behind, many that might be more or less suitable for individuals. And so we want to ensure that you're always keeping up to date. There are clinical trials that are ongoing that maybe you particularly could be a candidate or qualify for. Also, be mindful that this liver disease often, is to include MASLD and MASH, has some genetic components. So making sure your family members are being screened and that they're aware that they too could be at risk. And then keeping up to date with screenings such as your colon cancer screening, mammograms, all the preventative things that we expect anyone to do, but you in particular living with a liver disease, you want to ensure that no other thing is going on to complicate your life. And then also being screened for viral hepatitis like hepatitis A and B, ensuring that you're vaccinated for those things. And if your liver disease does progress, you want to be sure someone is monitoring you regularly for the development of liver cancer. So, all in all, I think that nutrition, diet, and exercise are paramount to navigating life with MASLD and MASH, but also being abreast of all the things that are up and coming, and also ensuring you're healthy all the way around is important.
Well, that's
Thank
great.
you. Those.
You covered quite a lot of things, and I have a bunch of questions I saved up for you. So,
Okay.
uh, I guess the first thing is the concept that there's a multidisciplinary approach here, that a patient may not be just seeing the liver physician, but they might also be seeing an endocrinologist because of their type 2 diabetes, or maybe a dietitian, as you mentioned, for obesity that they're struggling with. And so, how do they coordinate that as a patient? How would they, go from one to the other and make sure that they're communicating with each other? I was just hoping that you might be able to answer that.
I think that's a great question because that is a struggle for not only the patient, but also the clinicians that are taking care of the patient to make sure that everyone is in the loop and in agreement with one another. So I would say that the patient is really at the center and should be the main advocate for the discussions that are happening around their care. So if you see your endocrinologist and your endocrinologist decides to start you on a new medication for your diabetes,
Mm.
the physician that prescribed it should be sending a courtesy copy note to your primary care and potentially to your other specialists. But if for any reason you notice that that communication has not been made, you make sure that you call that doctor that did the
To keep
change
them.
and send and keep them and get the other doctors involved because all too often people do get lost to their follow-up because people don't know what's going on the other side.
Yeah, so your key message that I heard was that people should take control of these diseases themselves and not leave it up to their physician necessarily to come to them, right?
Absolutely.
Yeah,
I think
okay.
that as patients, you are in control and you're intelligent and you're knowledgeable and you're keeping up. You oftentimes teach us as your clinicians a lot of things. And by mentioning it, making sure that you are adamant that things are shared and that things are also communicated across your whole healthcare team is not an unreasonable request and should be happening.
You also mentioned something really important about supplements that people are taking, and we get often questions like, "Well, should I take milk thistle? Because I understand that that's helpful." And
Mhm.
so I think it's very important to speak with all of your physicians, or if to have the records, your medical records, so that they're current with what you're taking, because you don't want to start taking something on your own. You have no idea how that's going to impact, right?
That's right. And then many of these supplements are not FDA approved or regulated and are not uniformly the same. And so we cannot speak or endorse to any particular supplement's purity or effectiveness. And so I would tell my liver patients not to engage in those and only take what's prescribed and absolutely necessary. The liver is a powerhouse, it's self cleansing. And so if you just give it proper nutrition, and have a healthy lifestyle, you're going to treat the liver right.
Okay, I thought this is a related question.
Mhm.
I go to a lot of conferences. I thought that taking probiotics was a good idea. You just start hearing about the microbiota and how important it is. But as it turns out, from what I know, and I'd love to have your opinion too, that it's an uncontrolled area. And yes, it's probably true that the microbiota has an impact. But when you're buying these supplements, as expensive as they are, even though they're in the
Yes.
fridge and they look really great, that 20 billion, 40 billion, it still might not be anywhere near what you need. Is that right?
Absolutely. So you're right. There's a ton of data around the microbiome, and I'm sure that the microbiome is at the center of a lot of things, to include liver disease. But we're still investigating what that proper balance is and what the potential replenishment recipe should be. And so again, unless it is something that your provider, your clinician decides is appropriate for you, and then also tells you which one they would endorse, then it wouldn't be really left to you to just pick something that you see
Right.
at the local health food store.
I know,
Yes,
as well intentioned as it was, you don't want to do more harm than good for sure.
that's
So,
right. Absolutely.
well, my last point, just to follow up on too, you mentioned, which was also really important, was the familial relationships and risks. So that very often, well, first of all, MASLD is very common in the general population, but much more likely in the same family if somebody already has it. So, what's your recommendation for somebody who knows that they have it, and maybe other people in the family have not been even assessed?
Well, we're not. uniformly assessing for genes at it by any means, but we do know that there are genetics that are associated with MASLD and MASH. One in particular is the PNPLA3 gene. But what I recommend to my patients, especially if I have maybe a middle-aged individual, maybe a mom who comes in and has advanced disease, and we're really working with like cirrhosis and all the planning thereof, I ask that mom, bring your daughter in who's in her, say, her 40s. Let's look at her. Bring your son in, bring it cousins. We want to know if this is something that everyone might be secretly suffering with and have no idea.
Great advice. Lots of great advice from you today. And I always enjoy having these chats with you, and we'll do it again. Thank you so much for sharing such important and relevant information today.
Absolutely. Thank you.